Dr. Patrice Harris. I am Director of Health Services. One of the things I'm so excited about is our new focus in our health promotion activities. Certainly you will meet Nazira Dawood, who is our new program manager for health promotion. But we are turning the corner. Time, once you get somewhere, to take it to the next level. And that's what we're doing with our health promotion team. And this is our first major event since we embarked on our journey to take health promotion, the prevention of chronic disease to the next level.
We all need to be aware is that the group of people who are the most exposed to tobacco smoke today are children from secondary school.
I would sit there and wipe down the reality that this is an addiction that starts as a child that results in death.
The question is, what does tobacco have to do with the heart?
So let's get to the heart of the matter. If people
Cigarettes especially are an easy way for kids to act out.
In the case of tobacco use, our young people as well as our adults, we're not protected primarily from this chronic. We have to ask ourselves why. Why is this, based on what Dr. Erickson said, why are we not doing enough?
To teach them about how bad tobacco is when they're in elementary school.
And these are some of the things that are done on a federal level and a local level.
We are the fourth lowest in the amount of our state cigarette tax. Every state around us has a higher cigarette tax, and it's time to change it.
Our time is right, our time is now, and our time is running out.
To thank our community partners, and I want to bring greetings on behalf of my colleagues on the Board of Commissioners. This is a very important issue, and it affects me personally. My mother passed away 2 years ago, this week actually, from diabetes, and it affects the whole family.
The seventh leading cause of death, killing over 1,000 people.
Diabetes really is a 21st century epidemic. There's no question about it. It is sweeping across the world.
The impact of diabetes we have known for a long time. We knew this was coming.
A picture of the state of diabetes in Georgia.
The diet-controlled gestational diabetic does very well in pregnancy.
This is my A1C. Some of my patients I meet in the hospital have an A1C of 18%.
Here's to work for 7 of the hardest hit people you ever want to meet at the Fulton County Board of Commissioners. So I just want to come by today and say thank you to everybody. One thing I found out in government is people like information. That's one of our biggest problems. And when I come to things like this, and we're giving information, we're talking about issues, it's delightful for me to know that we're doing what we need to do.
Heart disease remains to be the single leading cause of death in the United States, in Georgia, in Fulton County.
The death rate from heart disease among men is a whole lot higher than among women.
Men. And look at the role that racism has in contributing to these racial disparities in cardiovascular health.
So, is this a common course of event that men feel ill or have problems and won't go to the doctor? Sure is.
The prevalence and significance of the problem specifically in the LGBT population.
Now therefore be resolved that the Board of Commissioners of Fulton County recognize the importance of health promotion to prevent cardiovascular disease, and does by proclaim Tuesday, June 28, 2011, as Fulton County's Men's Healthy Heart Day.
I have good news and bad news. Which one would you like first, the good or the bad? Actually, no, I'll give both of them together. Did you know married men live longer than single men? But single women live longer than married women. I wonder why.
We're the government. We're here to help. We don't make any money off of this. Without the kind of power that comes from a coalition like this and the various interests and organizations you represent, it would be impossible for us to really begin to bring awareness about what some of the influences are in our community.
We're talking about the elephant in the room, but we're really only looking at his feet. We're not looking at the brain, the brawn, the scope and scale of exactly how we come to be where we are.
Picture of the elephant, but I think of us as almost a tribe of people with spears trying to bring it down, and you have to be very strategic.
Yeah, she's up all night helping us.
Everybody should touch diabetes, everywhere she goes.
You can see here that overweight is 31% for Fulton, and obesity is 19%. The reality is we have to bring things where people's perspectives are and where their prejudices are. So that's why this whole issue turned into a consumer right to know. Turned into an issue of, hey, I'm a consumer, I should know what I'm buying and what kind of food. If I know what the mileage is going to be on the car I'm buying, why shouldn't I know what the calorie count is on the items that I'm buying?
What gets sustained? Any policy system and environmental change.
You're number one.
That is one that we should focus on. Okay. Which of these three, which three do you think we should focus on? The walking and bike trails and the family program?
Thank you for being here. I want to policy that outlays local businesses and follow that out. Really want to hone in on evidence-based practices that is out.
the city manager of the city of Milton. Felt that somewhere in the mission should be some recognition of working with community members.
What we said is, above everything else, we first have to define what is success.
Activities for delivering the message. We said effective, engaging, and interactive presentations throughout Fulton County.
Let's